Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Older people may experience undetected heart attacks more often than previously suspected, according to research published in the September 4th issue of the Journal of the American Medical Association. Some non-traditional symptoms of heart attack include nausea and vomiting, pain in the jaw, and sudden fatigue. Researchers from the National Institute of Health in Bethesda looked at the results of electrocardiograms, or ECGs, and cardiac magnetic resonance, or CMR, tests that were conducted on nearly 1,000 adults aged 67 to 93 who were living in Iceland. The investigators determined how many of these participants had experienced a traditional heart attack, as well as how many had signs of past heart attack, based on the ECG and CMR tests that went unrecognized when they occurred. They also looked at death rates through September 1, 2011. Overall, nearly 10% of participants experienced a traditional recognized heart attack during the study period. According to the CMR data, 17% also experienced an unrecognized heart attack. ECG results only identified an unrecognized heart attack in 5%. According to CMR, but not ECG data, the rate of unrecognized heart attack was particularly high among those with diabetes, a condition known to increase the risk of heart disease. A history of either a recognized or unrecognized heart attack increased the risk of dying. Knowing that an unrecognized heart attack had occurred based on CMR results helped the investigators predict who would die, even after taking into account age, sex, and a history of recognized heart attack. It also linked with the presence of other traditional risk factors for heart attack. Those with a history of unrecognized heart attack were less likely to be taking medications for heart disease than those with a recognized heart attack.
Well, the surprising thing about this study is that we found many more heart attacks in participants in this epidemiology study than doctors or the patients themselves knew about. There are almost 1.5 times as many unrecognized or silent heart attacks compared to the recognized heart attacks.
Today's research highlights the rates of unrecognized heart attacks among older people, especially those with many risk factors. It also suggests that using CMR to detect such events could help physicians determine who requires more intensive therapy to help prevent another cardiac event. For Insider Medicine in Depth, I'm Dr. Susan Sharma.